Do you sometimes feel that your heart beats fast right after you eat, or that you get dizzy and hungry for no reason? This can be a clue to a rare condition called Nesidioblastosis, also known as congenital hyperinsulinism. It happens when the pancreas releases too much insulin, the hormone that lowers blood sugar. Too much insulin makes blood sugar fall dangerously low, which can cause shakiness, sweating, or even seizures, especially in babies and young children. What causes the pancreas to act this way? In most cases, the problem is genetic. A baby inherits a change mutation in a gene that controls the insulin-producing cells. Sometimes the mutation happens for the first time in the child's new mutation. Rarely an injury or a tumor in the pancreas can trigger the same effect, but the majority of cases are inherited. Interactive example. Think of a recipe book, The Gene. If one page is printed wrong, every time you bake a cake, make insulin, you add too much sugar insulin, no matter how many cakes you make. How does the disease show up? Common clues are very low blood sugar, hypoglycemia, often noticed after a meal or overnight. Sudden jittery, sweating, or a fast heartbeat, like feeling nervous without a reason. Poor feeding or trouble staying awake in babies. Seizures or unusual behavior if low sugar lasts a while. Practical picture. Imagine a toddler who right after breakfast starts crying, looks pale, and seems shaky. That could be a sign of low blood sugar caused by excess insulin. How do doctors find out? First, a doctor will check the blood sugar level during an episode of symptoms. If it is low, they will measure insulin. If insulin is still high, that points to hyperinsulinism. Imaging tests, ultrasound, or MRI can look for a focal tumor, and a genetic test can confirm the mutation. Treatment aims to keep blood sugar stable. Medications such as diazoxide or octreotide can stop the pancreas from dumping too much insulin. If medicines fail, a partial or total removal of the pancreas may be needed. Always give the child quick-acting sugar like fruit juice when a low sugar episode occurs. Interactive tip: ask yourself, if my child suddenly looks shaky, can I quickly give them a small glass of juice and then check if they feel better? Can we stop it before it starts? Because most cases are inherited, the best prevention is genetic counseling for families with a known history. Couples who carry a mutation can learn about the risk to their children and consider options such as prenatal testing or pre-implantation genetic diagnosis. For families without a known history, there is no way to prevent the condition, but early recognition of symptoms can stop complications. Human note: think of a family planning a baby. Talking to a genetic counselor is like checking the road map before a long trip. Scientists are studying targeted drug therapies that specifically block the overactive insulin channels, showing promise in early trials. Gene editing tools, CRISPR, are being explored to correct the underlying mutation in laboratory models, which could someday lead to a cure without surgery. Additionally, newer continuous glucose monitors, CGM, are helping families spot low sugar drops earlier, reducing emergency visits. A child wearing a CGM that alerts the parents when sugar falls below 60 milligrams per deciliter can get treatment within minutes, preventing a